Hello, I'm Nick Mills, talking with Dr. Michael Wyand, CEO of Oxeia Biopharmaceuticals, talking about concussion. Clinical trials are underway for Oxeia's promising new concussion treatment drug, OXC103. Michael, in our previous discussion, you told us about 3 million concussions are reported in the U.S. annually, and many, many more go unreported. Do all of these concussion victims experience ongoing post-concussion symptoms?
So, Nick, of the patients who receive a concussion, there is a range of severity of symptoms and number of symptoms that they can acquire. In the mildest cases, patients will feel much better and have a lot of symptoms resolve after 7 to 10 days. Patients who have more severe symptoms, both in degree and in number, will generally maintain a large number of symptoms out through several weeks after their injury. And those patients have about a 30% chance of developing post-concussion syndrome, which is a prolonged persistence of symptoms out for weeks to months to sometimes years.
And what are the symptoms? I imagine it's quite a range of symptoms.
Yes, and the symptoms are in three different, what we call domains. The first is in the cognitive domain. So there's effects on memory, there's effect on judgment, on executive function, decision-making. The entire cognitive structure of the way our brains process information can be affected. There are emotional symptoms, such as anxiety or depression. And there are physical symptoms, such as loss of balance, nausea, vomiting. And those symptoms, those three groups of symptoms, will be present in various numbers and in various different distributions in different patients.
And how long do these linger? And they must take quite a toll, not only on the person who suffered the concussion, but on their families, at work, at school.
Yes, and that's one of the, I think, one of the sad parts of this injury is that if you sustain the injury and you're sent home and you have the mildest of the concussions, you might feel better in a day or two. And as I said, 7 to 10 days, you may feel like you're back to normal. But for patients who go home and spend several weeks in a dark room and have some type of persistent issue, and sometimes it's difficult for them to discern that it's necessarily related to the concussion. It could be anxiety, as I said, it could be some form of depression. And for those people, it can take them some time before they realize that what they're experiencing is actually related to their injury. So we need to do a little bit better job, and when people do get concussions, to make them aware of what the symptoms are and how the long-term consequences can affect them.
All right. Thank you, Dr. Wyand. In our next installment, we'll chat with Kartik Shah, one of the co-founders of Oxeia and a member of the board of directors, to learn more about Oxeia Biopharmaceuticals. I'm Nick Mills.